I'm Dr. Laura Stachel, and I know that you just had an opportunity to watch the CNN video. And that video really showed the beginning of a story that evolved over time. And so what I was hoping today was to share with you the evolution of the journey of a social entrepreneur. So when I went to Nigeria, I was completely unaware of the fact that there were hundreds and thousands of health facilities that did not have reliable electricity. And without electricity, it meant that doctors like me could not conduct surgeries throughout the night. It meant that midwives and nurses had to struggle in near darkness using candles or kerosene lanterns, or more recently using cell phone lights to try and provide a little bit of illumination in rooms that were otherwise very dark. And I saw the connection between that darkness and the inability of mothers and newborns to get life-saving care. And I was really upset by that. I didn't know how to take care of the problem at first, but I knew I wanted to do something. So it was really important for me to find people that could help. And I had the good fortune of being married to one of those people, Hal Aronson, who had been teaching solar electricity and immediately thought that solar energy could really be a solution to the problem that we were seeing. So at the beginning, there was me with my background in medicine, and there was my husband who knew about construction, he knew about solar electricity. But we knew nothing about international development, about how we would try and mass produce solar suitcases. We didn't know how to do the logistics of getting solar suitcases to where they were needed, or even how to identify which health centers were the ones that were in darkness. So we really needed to draw upon other people and build a team. The first team member was an engineer who helped design a model of the solar suitcase that could be replicated and eventually manufactured. We also brought in people who knew about business and finance, people who knew about communications and development and how do you actually do fundraising, and others who knew about logistics. And then we began working with other teams. We worked with international organizations, ones you might have heard of like Save the Children and UNICEF, and much smaller ones that were local community-based organizations that were trying to improve maternal and newborn health care, but that had not yet thought about how to solve the problem of energy poverty in those very health facilities. Working with those agencies and then later with ministries of health, we were able to actually identify those health centers that were in need and understand the scope of the problem, and then start to develop systems that could address that problem. So in order to scale our programs, we had to go from something that was a solitary idea, the idea of helping one hospital with solar electricity, to something that could scale. And to do that, we needed to make a technology that could scale, and that's the whole process of developing the solar suitcase, which you'll learn about elsewhere, as well as developing systems to train people in their own countries how to use the solar suitcase, and then how to do installations of the solar suitcase, and ultimately how to maintain and repair the solar suitcase. So we developed educational programs that would teach people in their own countries how to lead the solar installation program, so they wouldn't need to depend on people from other countries to do that. You can imagine that I needed to convince a lot of people to join me on this journey of trying to bring light to safe motherhood programs. And I found that one of the most effective ways to do that was to become a storyteller, that basically to tell the stories of what I was seeing, that was going to be a way that I could get other people to care about something that I personally was very passionate about. So I mentioned already that there had been a time I was doing a cesarean section, the lights went out. That was such a frightening experience. And I remember that when the surgery was happening, I was utterly shocked when the lights went out. And I was doubly shocked that the people with me in the room did not even have a reaction. They didn't have a reaction because the absence of light during surgery was so common that it was almost considered normal to them. And that really struck me as well, because I knew in my own hospital in the United States, if the lights went out, that would have been front page news. So now I can talk a little bit about the impact of our program. Over the last 10 years, we've reached more than 5,200 health facilities with our technology. We've led training programs that have built the capacity in more than 800 technicians to do solar installations and to maintain our equipment. We have taught more than 20,000 health workers how to use the solar suitcase and all of its contents. So that means using the solar equipment as well as the medical devices like the fetal Doppler that's included inside the solar suitcase. And finally, we've provided light and safer deliveries for more than 6.4 million mothers and newborns. That means more than 6 million mothers and newborns now have safer deliveries because of our programs. As I've learned more about the issue of energy poverty, I have felt that it's very important to share that with other people, not just people who are funders for us, but actually people around the world. And so now I speak at institutions like the United Nations, the World Health Organization, the World Bank, to try and allow policymakers who may not know about this problem to understand how very important it is. And I'm hoping that over time, they'll be able to bring resources to the problem and to really prioritize clean energy for safe childbirth. We launched an initiative called Light Every Birth precisely to try and get this issue on the international agenda. So Light Every Birth is actually guided by 3 principles. 1, every woman has the right to safe childbirth. 2, every health facility is entitled to reliable electricity. And 3, solar energy offers an immediate and a sustainable solution to this global problem. So for all of you budding entrepreneurs out there, what I'd like to suggest from things that I've learned is that you don't need to start out imagining you're going to save the world. What you need to do is identify if there's a problem that you care about. And taking a very small step can go a very long way. At the beginning of my journey, I only thought about helping one hospital, and even that seemed very, very difficult to do from far away. But after solving that one problem, I realized, boy, I can do something that I didn't know I could do before, and it allowed me to decide whether I wanted to take the next step and to solve additional problems. And so after the hospital, I started helping a small clinic near the hospital, and then another clinic, and then a few more clinics. And eventually we began to help dozens of health facilities. And it was only over a long time with a lot of other people helping that we created systems that allowed us to address more global problems. So find something you care about, take that very first step, and then see where that brings you. Again, I never knew at the beginning of this journey that we'd be ending up helping people around the world or have an organization that's leading an international movement. But I did care about the women I saw that were dying in that very first hospital, and I knew I wanted to do something about that. Good luck with your pursuits. We're so thrilled that you're learning about entrepreneurship too as you go on your own journeys. Thanks.